Hello aspirants, welcome to GDC English classes and welcome to Pharma Thunderstorm series. So thunderstorm is nothing but it is a thing from the environment. So it creates attention and it makes fear also. But here this thunderstorm series make you aware, make you alert and make you aware and alert towards achieving your goals. So anyway, in this video, we will discuss about simply what is pharmacology. So what you should study before entering into the autonomic nervous system, CNS, chemotherapy, endocrine, GIT, respiratory, etc., etc. First, you have to know about the general basics from the pharmacology. So in this video, I will try to explain why we should give importance to general pharmacology like pharmacodynamics, kinetics. After understanding this only, how you can get into further chapters like ANS, CNS, CVS, etc. Okay. So anyway, first of all, what is the pharmacology? So pharmacology is nothing but a study of drugs. What is simply? It is a study of drugs. Pharmacology nothing but it is study of drugs. And pharmacon means drug, logos means to study. And especially if you want to looking for the long term success. For example, most of us thinking that okay, this 1 year I will study for the GPAT, I will get a good rank. Maybe next 2 years, but always think in the advance like mutual funds. You will see ads on the mutual funds. Mutual funds say, hey, if you are really patient about your success. So put your money in the mutual funds for 5 years, 10 years, 15 years. How much time you will wait, that much etc. money you will get from that mutual funds. Like here also, once you are studying for the GPAT, you think like that, yes, this 1 year preparation definitely makes me success and definitely get me a good rank. That is sure. But this 1 year journey should be useful for my next future. For example, I completed my GPAT examination in 2013, also NIPER, and till now 2013, today 2025. Yes, I am in the teaching field from the 2015, and I am also teaching GPAT classes and pharma competitive classes because that knowledge only. So my thought process, yes, I am studying for the, yes, definitely I don't know. Around 2013, I am not having that much matureness, awareness, but I studied well, I prepared well. But that preparation of 1 year or 2 years continue my journey excellently, even in the number one pharma platform like GDC also. Okay, and always if you study with passion, determination, the things like basics concepts are like lipophilic substance can easily cross the blood brain barrier. So like that your study should be there because blood brain barrier allows only lipophilic substance. If you study with passion, interest in the different orientation from the others, definitely all things will reach the brain and they stay more time in the brain, and it requires simultaneous revisions. Okay, again we will enter into the topic. So pharmacology is nothing but a study of drugs. Pharmacology is nothing but a study of drugs. And for our convenient purpose, this pharmacology is again subdivided into two categories. One is pharmacodynamics, one is pharmacokinetics. So what is pharmacodynamics? What drug, I hope you know already what a drug does to body. Once a drug enter in the body, how it is showing its effect. In this pharmacodynamics, nothing but the drug enter into the body, pharmacon drug dynamics producing some effect, energy. So for that purpose, we need to understand different parameters here like general principles of drug action, mechanism of drug action, receptors pharmacology, combined drug effects, drug interactions, factors modifying drug action, adverse drug effects or adverse drug reactions. For example, general principles of drug action. How the drug showing their action. For example, some drugs like caffeine shows the action by CNS stimulation. Some drugs like barbiturates, they shows action by depressing the CNS, depression. Some drugs showing their action by irritation, like 𝙂𝙂𝙎𝙎𝙎. Some drugs showing their action like replacement. For example, in the treatment of diabetes, we will replace the insulin. If there is no enough insulin in the body, we have to take that insulin from outside of the body. And cytotoxic action. So drugs like antibiotics, anti-cancer drugs, especially drugs from chemotherapy, they shows action by kill the bacteria. And some of the drugs showing their action by osmosis. So general principles of drug action. So some drugs may stimulate, some drugs may depress, some drugs may act by replacement, some drugs may cause irritation, some drugs may cause killing the cells like bacterial cells, fungal cells, cancer cells, etc. So in that regard, we will study about the general principles of drug action. When coming to mechanism of drug action, mechanism, yes, all these are general principles of drug action. When coming to mechanism of drug action, some drugs may directly binding to the receptors, some drugs showing their action with the help of transporters by inhibiting transporter, some drugs may act by inhibiting the enzymes. For example, aspirin inhibitor cyclooxygenase COX enzyme. COX enzyme. So like that mechanism, some drugs may acting through the receptors, some drugs may acting through the enzymes, some drugs may acting through the ion channels, some drugs may acting through the transporters. For example, selective serotonin reuptake inhibitor SSRI, they're antidepressant, they inhibit the transportation of serotonin from postsynapse to presynapse and increase the availability of more serotonin at the synapse helps in the treatment of depression. Next, receptors. Receptors are like formulas for to understand the each subdivision of pharmacology. Like ANS, there is a drugs. CVS, there is a drugs. CNS, there is a drugs. Endocrine, there is a drugs. GAT, wherever you studied the subchapters of pharmacology, there should be a drugs. For that purpose, first we have to know what is the receptor. What are the general important points of receptors? If we have thorough knowledge on the receptor, for example, there is a ion channel receptor, G protein couple receptor, enzyme linked receptor, nuclear receptors. So first we have to know, for example, alpha 1 receptor. Alpha 1 receptor located on the blood vessel. Excess stimulation of alpha 1 receptor. Excess stimulation of alpha 1 receptor will constrict the blood vessel, increase the blood pressure. Overstimulation of alpha 1 receptor develop the hypertension. For that purpose, we have to block alpha 1 receptor for the treatment of hypertension. Okay. So, yes, alpha 1 is present on the blood vessel. If excess stimulation, I have to block the alpha 1 receptor. And same alpha 1 receptor present on the nasal mucosal blood vessel. So, stimulation of alpha 1 receptor in this nasal mucosal blood vessel help as a nasal decongestant, helps in the treatment of nasal congestion. So, alpha 1 blockers on the blood vessel, normal blood vessel, helps in treatment of hypertension. Alpha 1 stimulants in the nasal mucosal blood vessel helps in the treatment of nasal congestion, the condition in which excess accumulation of mucosal fluids in the nose. So, for that purpose, you have to know what is the receptor, what is the location of particular receptor, what is the function of receptor. So, what happens if that receptor stimulated, what happens if that receptor is antagonized. For that purpose, we have to understand the receptor pharmacology. Okay. And next, combined drug effects. What will happen when two or more drugs are combined? When two or more drugs are combined, in that combination, one drug may increase the action of other drug, one drug may decrease the action of other drug. Because of that, if one drug increasing the action of drug, that may lead to agonism. If one drug may decrease the action of other drug, it may known as antagonism. In the agonism, there is a additive action, synergism we will study. In the antagonism, there is a, again competitive, non-competitive, uncompetitive, like that we will study. For that purpose, we have to know combination of drug effects. Sometimes we need combination in the form of antagonism. We need combination in the form of agonism. To understand which one is agonism, which one is antagonism, we have to go through combination of drug effects or combined drug effects. Next, drug interaction. So what will happen when two drugs are interacted? Drug interaction. In this drug-drug interaction, drug-food interaction, drug-herb interactions. For example, grapefruit juice. Grapefruit juice is a potent CYP enzyme inhibitor. Don't combine with most of the drugs because it is potently decreasing the metabolic enzymes and it decrease the co-administered drugs. That means decrease the metabolism of co-administered or combined drugs. Decreasing the metabolism of drug, increasing the levels of drugs in the body, increasing half-life, increasing the side effect or toxic effect also. Okay. Next, factors modifying drug action. So factors modifying drug action, there are different factors like age, like gender, like body weight, like uh, species, like pregnancy, like disease condition. So there are many factors will affect the drug action. Simply age. So for the infant, okay, paracetamol is a drug for fever. Paracetamol dose for the infant. Paracetamol dose for the ear baby, ear children. Paracetamol dose for adults. Paracetamol dose for old age. Paracetamol dose for pregnancy. Paracetamol dose for the deceased patient. So for that purpose, we have to know. So on which, based on which age we have to change the dose also. So factors modifying drug action. One of the factor like a psychological factor. For example, psychological factor is the best thing. Okay, today I am presenting the presentation. I will succeed or not? Yes, I will success. Like that, positive attitude. I took the drug, it will everything perfect. I took the drug, but what will happen? It will decrease or increase my disease. Positive psychological factor. So our thoughts, our beliefs, our attitude directly proportional to drug action. If you think in negative way psychologically, drug action also decreases. So, for example, even our not only our old age people, we also, for example, for some critical condition, I used some drug in the previous days that worked well. Next time also, I prefer that drug only, I prefer that brand only because psychologically I satisfied. And even in case of old age people, once they having good experience on particular tablet, they will ask that drug only, that color only, that shape only. Otherwise, they don't take the drug because psychological factor is the most important one. Next, adverse drug effects are adverse drug reaction. So especially these are like unwanted reactions of drug, unwanted reactions, unknown reactions. Sometimes continuous usage of same drug or using of same drug at high dose may produce some adverse drug effects or adverse drug reactions which body does not wanted, body does not desire. The adverse drug effects are adverse drug reaction in the form of allergic reactions, type A, type B reactions, in the form of hypersensitive reaction. So we have to know about adverse drug effects, nothing but hypersensitive reactions, etc. So this is about pharmacodynamics. Pharmacodynamics. Okay. So before and even apart from this, we will also study route of administration, route of drug administration. There are many route of drug administration like oral, sublingual, rectal. These are generally comes under the what we call enteral. Generally, these are comes under the enteral. ENTRAL. Enteral. So, oral, sublingual, buccal, rectal, these are passing through the GIT. Enteral, enteron, intestine. When coming to parenteral, all parenteral like intravenous, intramuscular, subcutaneous, sublingual, intrathecal, into the spinal cord, intramedullary, into the bone, intra-articular, into the joints, intra-arterial, into the arteries. All these are comes under par, away, enteron, intestine, away from the intestine. So you have to know about each route of administration, what is the advantage, what is the disadvantage. So that is about pharmacodynamics. Pharmacodynamics means what drug does to the body. When drug enter into the body, it may show its effect in the form of. So for that purpose, you have to go through general principles of drug action like stimulation, depression, etc. Mechanism of drug action through which drug showing their action like ion channels, transporters, enzyme inhibition, And receptor pharmacology, we have to know detail about the receptors. Receptors are formulas for the pharmacology. If you understand the topic of the receptors, you have the knowledge about each receptor. It may be alpha 1, alpha 2, beta 1, M1, H1. You know about each receptor location, function, what will happen that receptor agonized, what will happen if that receptor is antagonized. Okay, so don't miss this video, watch the full video. Definitely this video will make you alert how to study pharmacology and why there is an importance of general pharmacology to get into remain topics of pharmacology in easy way. And definitely that easy way make the things basics concepts in the lipophilic and readily make it into the blood-brain barrier because blood-brain barrier only allows lipophilic substance. Next, pharmacokinetics. So pharmacokinetics, they are absorption, distribution, metabolism, elimination. Absorption. So pharmacokinetics means pharmacon drug kinetics movements. So pharmacokinetics, what body does to the drug, how body absorbing the drug, how body distributing the drug, how body metabolizing the drug, how body eliminating the drug. Nothing but elimination is a combination of metabolism excretion and excretion is the general process. Elimination will elimination is a combination of metabolism excretion. Elimination makes a drug inactive. So what is absorption? Movement of drug from the site of administration to systemic circulation. Where you administer drug, for example, I took drug in the oral. So from the movement of oral route to the systemic circulation is the absorption. For the absorption, there is a many drug absorption mechanism: passive diffusion, active transport, vesicle mediated, electrochemical diffusion, ion pair transport, etc. We have to go through all that because, for example, 90% of the pharmaceutical drugs undergoes passive diffusion for the drug absorption. So for that purpose, we have to understand absorption, drug absorption. Okay. So after absorption, once a drug enter from site of administration to the systemic circulation, from the systemic circulation, it have to reach the tissue target to show action, distribution, movement of drug from the systemic circulation to the target tissue, distribution to show pharmacological action. So for the distribution, we have to study what is the drug distribution. So how the drug distributed in the body compartments through the plasma, through the fat, through the intracellular fluid, interstitial fluid, transcellular fluid compartment like blood-brain barrier, and nothing but cerebrospinal fluid present in the blood-brain barrier, synovial fluid present in the synovial joint, placental barrier, and the ocular compartment, and peripheral compartment. So these are the special compartments like transcellular fluid compartment. So to these all compartments, how the drug distributed and what is the role of plasma proteins in the drug distribution like albumin, globulin, lipoproteins, etc., etc. Okay, and next metabolism. Once the drug completed its pharmacological action in the target, it should be metabolized in the liver. In the liver, drug should be inactivated. Once the metabolism is completed in the liver through phase 1 and phase 2 drug metabolism with help of CYP450 enzymes. With help of CYP450 enzymes. And the metabolism is like biotransformation. Initially, when a drug should enter into the body, it should be lipophilic, it should be non-ionic, it should be less molecular size or low molecular weight. These are the parameters make the drug good absorption. But in the metabolism, the lipophilic molecule of drug should convert to the hydrophilic molecule because hydrophilic molecules readily excrete to the kidney. Even after metabolism in the liver, still the drug is in the lipophilic nature. That lipophilic drugs again reabsorb at the kidney tubules. So reabsorption of drug increase the half-life and increase the toxicity of drug. So once after distribution, after completion of drug action, it should reach the liver for inactivation, and after inactivation it should go for the kidney for excretion or elimination. That's what excretion. because hydrophilic substance easily excrete to the urine. Okay, so this is a simple view about what is simply pharmacology. So what are the two branches of pharmacology like dynamics and pharmacology, dynamics and kinetics. There are many sub branches are there for our understanding purpose regarding B Pharm level, GPAT, NIPER, pharmacist drug inspector level. We have to study these if you want to, because GPAT is like a ocean. If you are really passionate about your GPAT preparation, the small rivers like drug inspector, NIPER, pharmacist exam and other allied pharmacology exams are easily enter into the ocean GPAT. Because in the GPAT you are studying total 4 years of syllabus. So definitely you are getting all the things, you can have some basic knowledge. With that basic knowledge you can easily crack the NIPER, drug inspector, pharmacist exams. So, and among these all exams, pharmacology is a major subject. And to get into in detail of pharmacology, you have to be must focus on the general pharmacology. For that purpose, you have to go through all these topics, as it's my responsibility from the GDC as a coordinator of GDC English classes and a faculty in the pharmacology. I will make all this general pharmacology easy for you, and I will make these basics concepts of this general pharmacology lipophilic in nature and make easily enter into blood-brain barrier, because blood-brain barrier allows lipophilic substance only. Okay, and we will see some MCQs on this general pharmacology also. So here, based on our small discussion about what is pharmacology, why the pharmacology is very important to get into the remind subtopics of all pharmacology. So based on that, we will discuss a small 5 MCQs regarding our Pharma Thunderstorm. So the first MCQ is here: who is known as father of pharmacology? I hope this is a basic question you know about, you all know the answer. So the options like Jonathan Pereira, Ramnath Chopra, Oswald Schmiddenberg, James Black. So the answer is simply Oswald Schmiddenberg was the father of pharmacology. Next, most of the drugs follows which of the following absorption mechanism? Because drug absorption is very important. Once you took any drug to any route of administration, it should reach the systemic circulation. If drug have a good absorption, for a good drug absorption, drug should be unionized in nature, drug should be lipophilic in nature, drug should be weak acid or weak base in nature, drug should be less molecular size or having low molecular weight. Okay, and here most of the drugs follows options like passive diffusion, active transport to pore transport to endocytosis. So 90% of pharmaceutical drugs, they follow the passive diffusion for the drug absorption mechanism. Passive diffusion for the drug absorption mechanism. Next MCQs. So third MCQ is here: what type of drugs can easily cross the blood-brain barrier? Which type of drugs can easily cross the blood-brain barrier? Option like large and lipid soluble, large and lipid insoluble, small and lipid soluble, small and lipid insoluble. So the answer is very clear. Small and lipid soluble. Option C is the answer. Small and lipid soluble can easily cross the blood-brain barrier. And even when you are studying about your subjects regarding GPAT, whatever it may be, make your basics and concepts like with passion in the form of lipid soluble. Lipid soluble, they can easily reach your blood-brain barrier, and the content, basics, concepts will stay for a long time in your brain. Okay, that require your passion, your way of intention, your way of studying simple logic. And GDC is always like that. Make the concepts basic in simple manner to easily penetrate into the blood-brain barrier of the student. And next question is: grapefruit juice is potent inhibitor of CYP2D6, CYP3A4, CYP2C9, CYP1A2. CYP450 enzymes are one of the enzymes present in the liver, mainly responsible for the drug metabolism. And here grapefruit juice is a potent inhibitor of CYP3A4 enzyme. It can inhibit the CYP3A4 enzyme. CYP3A4 is the enzyme responsible for many drug metabolism. So that's why don't combine pharmaceutical drugs with grapefruit juice. Okay. Next, therapeutic. Next question is therapeutic index is a measure of therapeutic index. The definition simply it is a rational difference between the beneficial effects of drug versus toxic effects of drugs. Okay, so therapeutic index is a measure of safety of drug, potency of drug, efficacy of drug, variability of drug. It does not tell about variability of dose response, whatever it may be. It does not tell about efficacy of pharmacological action. It does not tell about how much dose required by drug. It tells about safetyness of the drug, how much percentage the drug is safe, at what dose the drug is safe, which dose is suitable for the particular age. The safetyness of drug can be easily explained by the therapeutic index. So these are the 5 MCQs, simple MCQs from the general pharmacology. In upcoming videos and upcoming topics, we will discuss many things related in the form of making the things into lipid soluble small molecule and make them penetrate directly into your blood brain barrier. All the best. Subscribe to GDC English classes.